Solomon, founder of Royalty Home Care and Private Nurse Services. Today I will be talking to you about stroke. Stroke is one of the main causes of permanent disability worldwide, and there is a lot of people that is affected by this chronic illness every day. So I hope after sharing today you guys will be educated enough so we can minimize stroke. Now, stroke can be caused either by a clot obstructing the flow of blood and oxygen to the brain, and this type of stroke is called ischemic stroke, or it can be caused by a blood vessel rupturing and preventing blood flow to the brain, and this can be called a hemorrhagic stroke. Ischemic stroke is one of the most common type of stroke, and like I mentioned, it is caused by a clot obstructing the flow of blood and oxygen to the brain, causing brain cells to die. Now, where does this clot actually come from? On rare occasion, a sudden change of the heart rhythm prevents the upper chamber of the heart, and the upper chamber of the heart is the part that receives incoming blood. So it prevents the upper chamber of the heart from contracting normally, and when this happens, it slows down blood flow, allowing our platelets, clotting factor, and fibrin, which all plays a part of blood formation, to stick together. This clot can be carried up towards the arteries and blood vessels supplying the brain until it gets to one that it cannot squeeze through and cuts off oxygen supply to the cell downstream. So the brain makes up just about 2% of the body mass but consumes more than 20% of the oxygen in your blood. And that oxygen is carried to the brain through a system of arteries which supply both the front and the back of the brain. So let's just imagine if our main pipe was blocked due to an object that can't pass through. Then it will block our water supply. We won't have any water flow from that pipe, right? So imagine our arteries being blocked by a clot. Then the oxygen won't be able to flow because our arteries are what carry the oxygen. And if that's blocked, then the oxygen will not reach the brain, and our brain cells actually need oxygen to survive. So if it doesn't have that oxygen, it's gonna die. Our brain, another thing about our brain is that it doesn't have pain receptors. So when that blockage happens due to the clot, we can't feel that blockage itself. But when the brain is deprived of the oxygen, it slows down the brain function and can have sudden noticeable effect, which will be the symptoms of stroke. And for example, sudden numbness or weakness of the face, arms, or legs, sudden confusion or trouble speaking or understanding others, sudden trouble walking, dizziness or loss of balance or coordination, sudden severe headache with no known cause, just a few to mention. Knowing the warning signs of stroke and seeking immediate medical help can improve the outcome of stroke and also prevent you from permanent brain damage. Besides ischemic and hemorrhagic stroke, there is something called transient ischemic attack, or what we call a mini stroke, and it is caused by a temporary clot. So in a TIA, which is a transient ischemic attack, there is a temporary interruption in the blood flow to a part of the brain. So most TIA last only a few minutes and are sometimes referred to as warning strokes because they may sometimes be an indication that a full, far more serious stroke is about to happen. Also, the warning sign of TIA or the mini stroke are of the same of a normal ischemic or hemorrhagic stroke, which is the numbness and weakness of the face, arms, and leg, and trouble speaking and understanding others, and so on. They are the same. So, again, knowing the warning sign of stroke and seeking immediate medical help can improve the outcome. Also, with TIA, TIA does reverse and it can last for up to about 24 to 48 hours. Stroke is less common in persons under 40 years old, and although it does happen, it is less common, but it does happen. In young people, the most common causes are high blood pressure or sickle cell disease. I hope I was able to educate you enough on stroke, and I also hope that my information was clear enough for you to understand. Until tomorrow, listeners, I am Nurse Alicia Solomon, the founder of Royalty Home Care and Private Nurse Services. You can call or WhatsApp us on 666-3598. That is 666-3598. Or send us an email at aliciasolomon7@gmail.com. We are also on Facebook, so you can feel free to send us a message on Facebook at Royalty Home Care and Private Nurse Services. Thank you for listening.